Turning a group practice into an IOP or PHP in Kansas changes the business the moment you market structured addiction treatment. Before you advertise, confirm which Kansas source paths apply. KDADS licensing authority and KanCare payer context come first, not a launch date. This is a decision guide for Kansas group practice owners, where the risk changes, what to resolve before you market, and what to verify before you commit capital. We will cover the licensing question, staffing and clinical leadership, site readiness, and Kansas Medicaid and commercial payer planning. Your Kansas practice may already treat substance use disorders, co-occurring mental health needs, or clients who need more structure than weekly therapy. An intensive outpatient or partial hospitalization program can look like a practical next step. The better question is whether your practice has a referral base, payer path, clinical niche, and staff model that can support structured outpatient treatment. Keep the market research Kansas specific. Do not let another state's keywords, sources, or assumptions bleed into the decision. Here is the first mistake: treating IOP or PHP as a scheduling label. You are no longer only asking whether clinicians can run more groups. You are asking whether the practice can support a KDADS-aware treatment model. A practice that can bill ordinary outpatient therapy should not assume it can bill IOP or PHP services without separate review. The hard part is discovering too late that the service model, documentation, staffing, location, or claims workflow does not match the plan. Review the software stack at the same time. This is where Behave Health is designed to support the conversion. Behave Health's EHR, CRM, and RCM are designed to support admissions, group encounters, and treatment plan updates, plus credential tracking and authorizations. Through to Medicaid and commercial claims and reporting, the program-level workload a converted Kansas practice takes on. Before you announce the program, 4 readiness areas need real answers: the licensing question, staffing and clinical leadership, the site, and the payer path. First, licensing. Search phrases like Kansas IOP licensing requirements are discovery terms. They may not match the state's exact categories. Start with KDADS behavioral health licensing, its policies and regulations, and its provider information pages, the right official starting points. The threshold question: is the practice still ordinary outpatient professional services, or is it moving into a licensed SUD treatment program? A licensed program brings policies, surveys, program documentation, and payer expectations that need to be built before launch. Second, staffing. IOP and PHP operations need a program structure your outpatient schedule never required. Intake criteria, level of care placement, group schedules, treatment plans, utilization review, discharge planning, and consistent payer-facing documentation. Who verifies medical necessity and level of care? Who monitors group documentation? Who keeps the program aligned with KDADS and payer expectations? Build the plan from the population served, the services offered, Kansas source materials, and payer requirements, not a generic matrix. Third, the site. Structured outpatient programming can change what the location needs to do. Group rooms, privacy, accessibility, check-in flow, family participation, parking, emergency procedures, and records handling may all matter more than before. Can the site support the groups you intend to run and preserve confidentiality with higher volume programming? Answer those questions before marketing, credentialing, or payer contracting assumes the site is ready. Fourth, the payer path. Questions, not reimbursement assumptions. If Medicaid is part of the model, review KanCare first. The KanCare 3.0 M/S and MH/SUD benefit summary is a current official source for Kansas benefit context. Verify provider enrollment, facility or program credentialing, medical necessity criteria, and documentation expectations. Then, confirm authorization review and level of care billing with Medicaid and each commercial payer before relying on the revenue model. For broader national context, review Behave Health's billing and level of care guides. Guides to IOP billing codes and reimbursement cover H0015, H2036, S0201, and S9480 outpatient billing codes, plus the IOP level of care, PHP versus IOP, Medicaid, credentialing, and the best EHR for PHP and IOP programs. Use this as orientation, then verify the current Kansas path before you market or commit capital. Confirm specifics with KDADS, KanCare, managed care plans, commercial payers, qualified counsel, and your implementation team. Use findtreatment.gov to orient yourself to nearby outpatient and intensive outpatient providers. Behave Consulting helps operators pressure test the model before launch. Agency review, payer readiness, documentation workflows, admissions design, and implementation planning. Stop discovering too late that your program doesn't match the plan. Talk with Behave Health to scope your Kansas IOP or PHP conversion. Book a demo at behavehealth.com. Book a demo at behavehealth.com.